morning, student. We will continue lipid metabolism. Today's competency is competency number 4.4, and today's topic of discussion is classification, structure and functions of lipoproteins and role of lipoproteins in transport of cholesterol and reverse cholesterol transport. First, what are lipoproteins? Lipoproteins are compound lipids consisting of lipids and proteins, and hence the name lipoproteins. The main purpose of lipoprotein synthesis in the body is to transport the hydrophobic lipids from one part to other part through blood. If you see the structure of lipoprotein, we found three different layers: inner core, outer core and outermost covering. So inner core is mainly made up of purely hydrophobic lipids like triglycerides and cholesterol esters. The outer core is made up of amphipathic lipids like phospholipids and free cholesterol, and the complete structure is covered by hydrophilic proteins called as apoproteins. Now we will study in short about the nature of lipids. So triglycerides, they are purely hydrophobic in nature, so they occupy at the inner core. Along with triglycerides, cholesterol esters, they are also purely hydrophobic in nature, therefore they are also present in the inner core of lipoproteins. Then outer core is having amphipathic lipids like phospholipids and cholesterol, free cholesterol. So in this, if you see the structure of phospholipid, that phosphoric acid and nitrogen base, it forms the hydrophilic part of phospholipid, whereas the remaining part of phospholipid is hydrophobic. Therefore, phospholipids are amphipathic in nature. If you see the structure of free cholesterol, then we found that the hydroxyl group is hydrophilic in nature, whereas the remaining steroid ring is hydrophobic in nature. Therefore, free cholesterol is also amphipathic in nature. So, depending upon the nature of lipids, they get arranged into the lipoproteins. The lipids found in the lipoproteins are triglycerides, cholesterol esters, free cholesterol and phospholipids. The proteins found in the lipoproteins are called as apoproteins, and these are ApoA, ApoB48, ApoB100, ApoC and ApoE. So these are the different proteins forms the covering of lipoproteins. Now we will see the types of lipoproteins. The lipoproteins are classified depending upon two ways. First, depending upon centrifugation, and second is according to their mobility on electrophoresis. In the left side, I have shown you the test tube in which you will see four different bands of lipoproteins are separated. If we centrifuge a serum, then it consists of a band called HDL, which occupies the lowest portion of the test tube because it is high density, followed by a band called as LDL band, means low density lipoprotein. Next band above LDL is VLDL, so very low density lipoprotein band, and the uppermost band is chylomicron, which has lowest density, therefore it occupies at the top. So in this way, the lipoproteins are classified depending upon their density into HDL, LDL, VLDL and chylomicron from below upward. Now lipoproteins are also classified depending upon their electrophoretic mobility. On the right side, I have shown the four different bands of lipoproteins. If we apply a serum at origin, then these lipoproteins migrates towards the positive terminal. The HDL shows highest mobility and moves farthest, and they are called as alpha lipoprotein band. Then next to HDL is a pre-beta lipoprotein band which consists of VLDL, very low density lipoprotein, and then it is followed by a third band called as beta lipoprotein band which contains mainly LDL, whereas chylomicrons shows minimum mobility and they remains near the point of application of serum and they constitute the gamma band. So in this way we classify the lipoproteins into alpha lipoproteins, pre-beta lipoproteins, beta lipoproteins and gamma lipoproteins. Now we study the composition and functions of lipoproteins. First, chylomicron. The lipid present in the chylomicron is mainly triacylglycerol, cholesterol ester, phospholipid and free cholesterol. Now, functions of chylomicron. As all of us know that these chylomicrons are synthesized in the intestine after meal. So the functions of chylomicron is to transport the absorbed dietary lipids from small intestine to the peripheral tissues and liver. Next, chylomicron is VLDL, very low density lipoprotein. The lipid composition is similar to chylomicron. It is also rich in triacylglycerol followed by cholesterol ester, phospholipids and free cholesterol. So this chylomicron and VLDL are rich in triacylglycerol. Now this VLDL is synthesized by the liver to transport the triglycerides which are synthesized in the liver to the peripheral tissue. So VLDL will transport the lipid, mainly triglycerides, from liver to the peripheral tissue. It also contains the cholesterol at the inner core. Next lipoprotein is LDL, low density lipoprotein. It consists of cholesterol esters in the core and phospholipids at the outer core. Now, the function of LDL is it transports the cholesterol to the peripheral tissues. Therefore, cholesterol get deposited in the peripheral tissues, mainly in the medium sized and large sized arteries, leading to a disease called as atherosclerosis. Therefore, this LDL is called as bad cholesterol. Next lipoprotein is HDL, high density lipoprotein. Its composition is cholesterol esters and phospholipids. Now this high density lipoprotein takes the cholesterol from the peripheral tissue and transport back to the liver for its excretion. Therefore, this HDL does not allow the cholesterol to deposit in the peripheral tissue, so it has preventive effect against atherosclerosis. Therefore, this HDL is called as good lipoprotein. In the blood, the normal cholesterol level is 150 to 200 milligram per deciliter, and cholesterol is transported in the blood by two lipoproteins, just we have studied, LDL and HDL. Now this LDL take the cholesterol from liver to the peripheral tissue for deposition, so it causes atherosclerosis and hence it is called as bad lipoprotein. Whereas HDL causes reverse cholesterol transport, that is, it takes the cholesterol from the peripheral tissues and transport it to the liver, where they are converted into neutrosterol and excreted into the stool. So they prevent the atherosclerosis, therefore they are called as good cholesterol, and this cholesterol is also referred as reverse cholesterol transport. So this is about classification, structure and functions of lipoproteins, role of lipoproteins in transport of cholesterol and reverse cholesterol transport. Thank you very much.